Welcome back, 8:45. For the past few months, it seemed like our attention was first consumed with the pandemic and then more recently with the tragic death of George Floyd, followed by the protest. In all this turmoil, though, attention to our chronic health conditions and the prevention of disease may have been neglected. So we're going to have our 9 Health expert on every week to talk about risk factors for our series called Prevention During a Pandemic. So we've got Dr. Payal Kohli. She joins us now. Good morning, Dr. Payal Kohli.
Hi, John. Good morning.
Let's get right to it. Tell us about COVID-19 and diabetes. What do we know so far?
Well, John, we know that COVID-19 and diabetes don't go well together. So having diabetes in and of itself may not necessarily increase the risk of contracting COVID-19. But once you get COVID-19, there's a significantly higher risk of complications and of dying. And we've seen this in a number of series coming out of China, as well as most recently coming out of New York. In fact, in New York City, out of 5,700 people, 1 out of 3 of them coming to the hospital had diabetes. But there is some good news, which is that you can actually reduce your risk of complications from COVID-19 and from other complications of diabetes like heart disease, kidney disease, eye disease, if you control your diabetes. So controlling diabetes is really a key. And even though we're in the midst of a pandemic, we really have to focus on prevention.
Now, for those of us who have not been able to go to the doctor due to the pandemic, any suggestions there?
Yeah, so one of the most important determinants of outcomes in diabetes is how well your blood sugar is controlled. So blood sugar control is key. And the way that we normally check that is by getting a blood test called a hemoglobin A1C. And that tells us about our blood sugar control over the last 3 months. Now, if you're afraid to go to the doctor or can't get to a lab or would rather not get a blood test at this time, I can understand that. But you can check it at home with something called a glucometer, which a lot of diabetics already have. But if you don't, you can order it online. And it basically tells you about your blood sugar control. And what the American Diabetes Association recommends is a blood sugar less than 180 after meals for diabetics. The other thing I would recommend is setting up a virtual visit with your doctor. So you don't have to be feeling sick or unwell in order to have a virtual visit. Just check in to talk about your diabetes, talk about when you should get your eye exam, when you should get your foot exam, how well your sugars are doing, and make a plan for exercise, for losing weight, for nutrition, all of the things that can help you with that blood sugar control to decrease your risk, not just from COVID, but from long-term complications such as heart disease.
So important to monitor those levels. So most of us are asking now, if we are at risk for developing diabetes, how do we know? What should we do?
Yeah, this is a tough one, and you're not going to know unless you start looking. So I would strongly recommend that you proactively figure out whether or not you're at risk for diabetes with a condition called prediabetes. The nice thing about prediabetes is that it's reversible, so you can actually prevent it from progressing to diabetes. So I would recommend going to 9healthfair.org and doing their free prediabetes and diabetes screening online. And you could put in your family history, your age, your activity level, whether you've had gestational diabetes, many different factors, and come up with a personalized risk score for what your risk is for progression to diabetes or prediabetes.
Always great insight. Thank you so much, Dr. Kohli. You can join our conversation on chronic health conditions today at 11 a.m. That will be on our 9 News Facebook page live. 9 Health. We'll also talk about how to prevent type 2 diabetes during the COVID-19 pandemic and other chronic conditions. Let's get a check on the forecast with Marty.